Greetings. Later this summer, Dr. Glenn Steele will step down as president and CEO of the Geisinger Health System. I sat down with him for an exclusive interview to talk about his leadership and experiences at Geisinger. We began our conversation about the recently announced Justin Ford Kimball Innovators Award.
Reaction. Congratulations.
Well, it's been a gratifying end of my multiple leadership careers, and I'm honored, and I look forward to joining some of my old colleagues at the American Hospital Association to accept it. I think it's on May 5th. So, and as usual, most of those awards are not just for me. Most of them have to do with how successful Geisinger's been over the last 15 years.
While that award recognizes Dr. Steele, he agrees that it is a team effort to implement a new vision for delivering health care.
Well, we had a perfect, I think, coming together of lots of good stuff over the last, I'd say, 12 years of the 15. I mean, the first couple of years were pretty tough in recovering from the demerger with Hershey-Penn State. But I think over the last 12 years or so, 12 and a half years, our ability to show what an organization that's structured like Geisinger, serving a population that we serve here, which is older and has a lot of illness, but is very stable. What you can do with a fundamental re-engineering of how care is given. I think that caught the imagination of the nation. And it came at a time when people were looking for different models of caregiving as we made a commitment to try to ensure what was before ACA, 45 million uninsured Americans. And so I think it's been a great confluence of events. Plus, it's been a great representation of what an organization can do if it really gets committed.
When asked about his own contribution to Geisinger's success, Dr. Steele says he is the visionary.
First of all, I saw the vision, and I aspired to something that I think was beyond what most people thought could happen. I remember presenting the aspiration and presenting the vision to the board when I first was interviewed in Philadelphia. So it was consistent with what I talked about early on during the selection process. I think I was able, after the kind of institutional PTSD of the demerger, I think I was able to create a narrative that was a compelling narrative for a huge number of superb people in central Pennsylvania and the Northeast. And then I think we were very fortunate when our first road test for fundamentally changing how we gave care and then how we paid for care, that so-called proven heart. I think we were incredibly fortunate that got such a tremendous amount of good feedback, and then it became a leveraged set of additional road test successes, and so I think I was the cheerleader. I think I was the visionary. Everybody else did the hard work, and I think that it's paid off.
Though he's been at the helm for more than a decade, Dr. Steele sees Geisinger not just from the perspective of its leader, but as one of its patients.
Well, I mean, I see Geisinger not just as a leader of Geisinger, but I see Geisinger as a patient as well, and I probably wouldn't be alive without Geisinger. I'm 10 years or 11 years older than my father. I'm on average 15 years older than any other male that has been in our family, and there are specific reasons for that Geisinger is responsible for. I would say right now we're up to 4 organ systems that they've worked with me on, and I look pretty good from the outside, if I don't mind saying so myself. But occasionally, when I'm elsewhere or my family's elsewhere, and they go to places that have great docs and great nurses, we're just stunned at how inefficient the systems are. And inefficient systems can really mitigate the best of the providers, whether they're nurses and docs. And so I'm just constantly amazed at how good the overall system of care is here, and how many people, regardless of whether they're heart surgeons or brain surgeons or people who are working in our engineering facilities, actually know what we stand for, know what our 3 strategic goals are, and are really turned on to deliver those. That's an amazing thing.
As a leader, Dr. Steele says it's gratifying when others take his vision and create their own success.
Well, that's one of the most gratifying things about leadership. And I think and this happened well before I came to Geisinger, but I think if you don't get a huge amount of indirect pleasure out of other folks' success, you're not a true leader. If you're trying to create a huge amount of success to prove your worth to your mom or whatever the psychological underpinnings are, you basically run out of leadership energy and credibility fairly quickly. So when I look at a young guy, and I'll give you a specific example without a name, when I look at a young guy who is a well-trained thoracic surgeon who takes our concept of attacking unjustified variation and applies it to the treatment of lung cancer, and he takes it from a Geisinger road test and applies it in a national setting with a combination of help from the American College of Surgeons, plus the American Cancer Society, plus the discipline that he's in, Thoracic Surgery Society, and he creates a 21 institution national scale up, and we get results, and he gets to publish those results and analyze them, and he gets celebrated nationally for that. I mean, that's one of so many examples of individuals who I'm particularly proud of. That's the privilege and the reward of leadership.
Steele is a hands-on leader who frequently is seen around the Geisinger campus.
Oh, I walk around all the time. It's been a little bit frantic over the last few months because of the transition and the search, and working very hard to make sure that all the things that generally happen during the end stage of a successful gig are at least under some control. But before the last 6 to 8 months, I spent a lot of time walking around and talking to what I call the real workers. Well, I mean, the first thing I say is thank you. The second thing I say is your work is just as important to the accomplishment of our goal, which is higher quality, lower cost, more satisfying, interaction with the people we serve. Your work is just as important as the heart surgeons and the brain surgeons. And and I basically, usually in groups, not so much individually, will ask them, how do you think things are going? It's very important.
I asked Dr. Glenn Steele what he felt was his greatest accomplishment.
Probably the increase in the recognition and the understanding of Geisinger as a innovative, continually innovating healthcare system that gives great care regionally, but is a national and international model. So, I mean, the way that business people would talk about it is brand recognition increase. I think that the recognition of Geisinger over the last 15 years has been one of the most phenomenal things that I've ever experienced, and other people comment on the same thing. I mean, when I came here from Chicago 15 years ago, we had, that was my own personal kind of visionary, almost psychotic commitment to see if we could do something unique. Being able to get our first choice as a successor, David Feinberg from UCLA, that's proof. That's really proof of principle that here's a guy who leaves Hollywood, leaves a 20-year incredible leadership trajectory at a great academic medical center with a slightly different institutional affect and a different sociology, Bel Air, Westwood, Hollywood, and comes to Danville to succeed me and is thrilled to be here. That's pretty good affirmation for what's happened.
Dr. Steele said he stayed out of the search for his replacement until the final candidates were chosen.
I chose during this process of a search, I chose to stay out of the details of that until we had a finalist group of candidates. And I did that for a couple of reasons. Number one, I wanted the board to and others to know that that I was not the individual who was influencing the decision. I don't think in our setting that that's the best practice. I think you have to do a full search. Now, I've helped the board and I helped the chairman, along the entire way, and I was involved after the finalist candidates were picked. So it's a very limited, it would be a very limited denominator in terms of what I learned. I mean, what I did learn was that the candidate pool was superb, both internal and external. What I did learn was the positive affirmation, when our first choice accepted readily and quickly. I also learned that, he was anxious to start. So anxious, in fact, that that the turnover is earlier than we had planned. And trust me, that's good for me because this lame duck thing is not natural to my DNA expression.
What do you leave unfinished?
Oh, there's innumerable unfinished stuff. I mean, the volatility that we're experiencing now, particularly on the insurance company side because of ACA or Obamacare, is huge. And that means it affects the design of our insurance products. It affects the margins that we can expect. The rules, as you know, have continued to change after the legislation numerous times. And when you're a huge insurance company, like Anthem or like United or like Aetna, it's easier to buffer the volatility. When you're reasonably large like us, which is now over 500,000, that volatility really, is really a challenge. So, dealing with that volatility over a period of time, and still being able to maintain the sweet spot between our payer and provider, which is really the engine of our innovation, is going to be a continuing challenge. On the clinical enterprise front, where we're providing care for patients, there's an immense and continued need to build program, to renew program. I mean, if we're going to Scranton, we have to build program there. If we're going to Holy Spirit in Harrisburg, we have to build program. If we're going probably, in the early part of the summer to Atlanticare in New Jersey, we're going to have to build program, particularly population health program. They've got a lot of the good hospital-centric intervention stuff, but the population health stuff is what we're known for. I think the M&A activity, all the mergers and acquisitions that are going on now, I think to a large extent those represent old-fashioned structures where you try to beef up your provider side so you can increase your leverage and get greater reimbursement from the payer. That's not our religion. That's not been my religion. We've attempted to do inclusions, joinings, whether it's Holy Spirit or whether it's Scranton, or in the old days whether it was South Wilkes-Barre, and now Atlanticare. We try to do these expansions with people coming into our organization, and focus on going into those markets, creating a different kind of care, higher quality and lower cost. And that is easy to talk about. It's much harder to do. And to distinguish ourselves from other very good enlarging organizations that may be getting, 70% market share, for instance, which is the anticipated Pinnacle Hershey kind of deal. But, with less of a commitment, I would suspect, to really keeping people healthier and out of the hospital. So I think there's going to be huge challenges, and then I think the big challenge is, when I came here, again, it was a perfect starting point. We had a tremendous amount of morale issue. We had a tremendous amount of leadership issue from the 3.5-year dysfunctional merger with Hershey, Penn State, and when you're starting, to build from a near-death experience, whether it's financial or whether it's in terms of the sociology, it's a lot easier than when you're perceived of as where we're perceived of now, and you're trying to take the next step up. Now I feel very good about Dr. Feinberg, very good about David, but I think he's going to have a really interesting. He's going to have a much more difficult set of challenges than I had.
And as for the new parking garage?
Yeah, no, it's filled. So of course it's a success, yeah. Of course we don't charge for it, right, but that's okay. It saves us a huge amount of surface area. I mean, if you look at this new building that's going to open up in, May or something, when I came here, people thought that there was an infinite amount of surface, in our campus here at GMC. In my kind of visionary or semi-psychotic way, I thought, it's not going to last forever. We're going to have to build. Even though we try to keep people out of the hospital, even though we, try to get people who have less severe stuff that don't need to come into a big house like GMC and can go to Shamokin or Bloom, we still have a huge amount of demand here, and we have to create facilities for that. So now I'm very pleased. I was worried for a while, but I'm very pleased.
This has been a difficult transition for Dr. Glenn Steele.
It's terrible. I've actually walked away from every other job. I made a decision Thursday, and Friday I was gone. And that wasn't because I was a jerk. It was just because of the sociology of the place. And I felt proud of what I'd accomplished in Boston. I felt proud of what I'd accomplished in Chicago. And when it was done, it was done. And then they marched on. And I've always been comfortable going back. And they've been, they haven't, they haven't thrown stones at me and what have you. So we created value. This is a little different. I mean, I felt as if it was important to have the transition, but it's been difficult. So, I'll miss the people. So,
Dr. Steele had a few parting words to the valley that he's called home for the past 14 years.
Well, first of all, it's been a great privilege and an honor to be here. It's a great place to live, great place to work. And, I think one of the benefits of what we've accomplished here, whether you're talking about 7,000 workers to a total of now almost 24,000 workers, not all in the valley, but spread throughout, I think the ability to recruit great people to come here, it's been a privilege to do that as well. So the secondary aspects, not just the increased healthcare provision, not just the different ways of giving the care, but all of the other business aspects that are a consequence of our success has been really gratifying, and the support of the people around here. I mean, we've had tremendous support. I've worked hard at reaching out to folks where we hadn't had good advocacy, good community impact, and whether you're talking about EVAN, whether you're talking about EVAN and Bucknell and Geisinger, whether you're talking about Bloom and Bloomsburg, whether you're talking about Shamokin. I mean, the fact that we've been able to reach out and in various ways, not just through acquisition or merger, but in various ways, create a network of commitment with Geisinger and non-Geisinger, that's been aided by the fact that I think the community advocates don't fear Geisinger the way they feared Geisinger. They always respected Geisinger. When I came here, they feared Geisinger. I think they now respect it, but they feel as if Geisinger is a part of the community, and I'm very proud of that.
I asked Dr. Steele for his version of Dr. Stephen Covey's 7 Habits of Highly Effective People.
Well, first of all, you've really got to be comfortable with people, and all kinds of people, and there are limits, obviously, but I enjoy people. That's number one. Number two, as I said earlier, you've got to get a tremendous amount of vicarious pleasure out of other people's success. I mean, I think that's a huge part of leadership. Number three, if you have a vision, you've got to make sure that the individual who's actually going to be transacting the vision shares your vision, understands it, may be able to modify it. You're not just going to be able to send a memo and get that person to do whatever it is you are fantasizing or visioning. You got to be willing to make mistakes, and we've had an interesting dynamic here, where I would say probably 15 to 20% of our innovation is allowed not to work. Now we cut it off quickly if there's any potential for a negative impact on patients. But you've got to do that if you're really going to be innovative. And then you have to start all over again. You have to modify, what have you. I think you have to respect and understand the fact that as a not-for-profit, even though we make a good profit, but as a not-for-profit, we have to prove ourselves as bringing value to the region on both the payer side as well as the provider side. And then I think there's governance. You've got to have. I was blessed during my time at Geisinger with a great governance group, some of whom I helped to bring in, because we started to bring in not only regional leaders but national leaders. But I really almost never had to sweat any of the politics that quite often I was exposed to when I was in Chicago or when I was in Boston. I was focused almost exclusively on the substantive issues that we've tried to address, whether it's insuring more people, whether it's creating a different relationship between our insurance company and our provider, whether it was building more clinical programs, whether it was bringing in more leaders. So and I could go on and on. It's probably more than 7.
Okay. Finally, Dr. Steele commented on the importance of Geisinger Health System to the people it serves.
Well, I think the best way of summarizing that is to say that, Geisinger is such an important fabric, such an important part of the resource here, not just because of the job expansion and what have you, but because of the healthcare giving, that it's not referred to as Geisinger Health System by people here. It's referred to as the Geisinger. And it kind of reminds me of the days when we used to refer to the icebox as the fridge. I mean, it's almost taken for granted how good Geisinger is. And that's pretty affirming. Now, there's all kind of metrics. You can look at quality metrics and cost metrics, and there are metrics on both sides of the house, both the payer and the provider side. But you know, you don't get the integrated calculus of those metrics, as well as all of the individual patient stories and the individual insurance company member outcomes, and that all has to be wrapped into the brand increase. It has to be wrapped into when people have a really big bad problem, they go to the Geisinger, and that's a pretty amazing affirmation.
Mark Lawrence, News Radio 1070, WKOK.com.